Hey guys, Alexandria Ross with Modern Day Crunch. Today we're going to talk about painful nipples. Fun topic, right? But it's a very, very common thing in breastfeeding, in the beginning of breastfeeding. And it doesn't have to happen. So, how do we deal with pain? And if your nipples hurt so bad, why should you continue breastfeeding? Well, the good news about pain is it's completely treatable and or preventable. So usually if when you're nursing it hurts so bad, or you have cracked nipples or bleeding nipples or there's just really tender nipples, usually it's related to the way the baby is latched. This is a great thing because it's fixable and it's correctable, really. So if you're suffering from super painful, super tender nipples after nursing or while nursing, what we need to do is try to get a deeper latch. So when your baby's nursing, I want you to look at them and look at their mouth and see where it is. They should have a lot of the breast in their mouth. It's called breastfeeding, not nipple feeding. If they're just on your nipple and they're pulling at your nipple, and if it's pinchy and painful and you feel like every time they nurse, then probably they're just on your nipple and their mouth is just barely open. If that's what you see, then you need to get the baby off and wait till they open wide and bring them in quickly to help them get a deeper latch. I know you're probably thinking, yeah, well, my baby won't open their mouth, or that's easier said than done, which is true. It is easier said than done, but it's so important because if your baby has a shallow latch, yes, it's painful, but more importantly, they're not having an efficient feed and they're not getting as much milk as they should be each feed. When they feed just on your nipple, it's like sucking through a small straw. It takes a lot longer. So they're on there even longer and they're not getting as much, and you have painful nipples. Not cool. Some women, like I said, they think that this is just part of breastfeeding, and it absolutely is not part of breastfeeding. Yes, it may happen, but it doesn't have to happen. So if you're suffering from super pain, or if you're cracked, or if you're bleeding, I really suggest going to see a consultant or a lactation specialist, or maybe a girlfriend, or go to a mother's group if there's one nearby to help you, because a lot of times it's easier to help when someone is there with you. But if not, I encourage you to really watch your baby, and when they open wide, and it's a split second a lot of times for a newborn, when they open wide, make sure you bring them back and just bring them in fast. And don't feel bad about bringing them in quickly. You're just helping them get a deeper latch. You're not being forceful or being mean when you do this, but it's necessary. And I promise you, when they have a deeper latch and they're latched appropriately, there is no pain. Breastfeeding doesn't have to be painful, and if it's done correctly, it's absolutely not painful unless there's something else going on anatomically with the baby, or maybe possibly even your breast. So if you're having painful nipples, seek help and try to get your baby to get a deeper latch and more breast in the mouth, and I promise you, you'll feel better. In the meantime, you can use colostrum or breast milk on your nipples for comfort, lanolin, or the hydrogel pads, which I love. Lancinol has some, I think Medela has them as well, and they're little pads that you actually just put on your breast in between feeding, or your nipples in between, and it has like the lanolin built in it, and it's great. Moms love it, so I would try that in the meantime. But overall, you must fix the latch, okay? You must fix the latch. Do not go to pumping instead, because you have to teach your baby how to do it. So that's my advice for painful nipples and how to hopefully fix them and prevent them.